So the gold standard for intermittent catheterization is important for you to know so that you know how much they're supposed to get every time they cath. If they're only getting 200 milliliters, that's not enough. Maybe they're not drinking enough water. Maybe they did it too frequently, and so they're not getting enough. 4 to 6 times a day, really 4 is what you want to go for. I try to keep people on a schedule. A lot of times they get so in the habit in the hospital of the nurse coming and knocking and saying, "Did you cath yet? Did you cath yet?" And then the first moment that they're out on their own, they forget and they go 8 hours without cathing, and it's just a nightmare. So setting alarms, whatever log they need to figure out what is the frequency of time and how am I going to stick to that time and remind myself to do it. So that is the gold standard. But of course, there are limitations to this. Like Monica mentioned, maybe they are a little larger. Maybe they have an overactive bladder. Maybe they have a very tight sphincter. So passing the catheter through is like a real tragedy. And so it's not worth doing that. They're causing more trauma than anything else. If they're somebody that hydrates a lot, it's not good for them to be trying to cath 6 to 8 times a day because their bladder is so full. So either they have to limit what they drink or maybe they need to go a different route. So there are a couple of reasons why intermittent cathing might not work for someone. So the advantages are there's a routine, there's no external bag. You know, people are hung up on aesthetics. They want to make sure that people don't know what's going on. So if there's a bag, they see a leg bag, a Foley bag, whatever, people don't like that. So if you use intermittent cathing, you don't have to do that. It also stimulates your bladder to be more on the normal side. But the disadvantages are they have to track their fluid. So if they are a younger adolescent, which most of our SEI patients are, they're not going to do that consistently. A lot of them are not going to. There may be some pain with passing the catheter through. You have to get undressed or dressed. Body habitus plays a role. Trunk control plays a role. So there are a lot of considerations for the intermittent cathing as well. So this is a video on the clean intermittent cathing technique. I'm going to skip this one, but I included it so that you could reference it back if you needed to. But it's a nurse that's going through clean and intermittent technique. She has an anatomy model of a female actually that she shows how to do the technique on. So if you have a patient who needs a video that you can send to them, this is a really great video actually for them to be able to watch and then try at the same time. So I left this one in here for a good reference for if it's somebody that you're just teaching or a therapist that, because there are a lot of therapists that we train who are not very well versed in teaching somebody else how to do this. So these are great reference videos for you as well. Considerations for the female, it's a little bit trickier for the female patient because they get confused of where to insert. The anatomy is a little bit more difficult. You get it in the wrong hole and all kinds of things. So some things that are out there to help, like this right here. Let me see if I can get my laser pointer. This is a really cool device. Essentially, this part goes inside the vagina and then the holes line up to the exact supposed to. Everybody's anatomy is different, but it helps to line up the catheter to the right place where they're supposed to get into the urethra so that they can be in the right place. So we've used that, but I've also used a good old tampon, and that's been able to help them not get into the vagina by accident and go into the right place for when they're just learning, especially if they can't see where they're going and they just have to get a feel for it. So those are some things that we've used because you can cause some trauma to the area if you are continuously getting into the wrong place. The leg mirror that I mentioned before
If
is
you're
a
a
really
catheter
helpful
user,
tool.
listen up. This is your sign to order your free LED leg mirror from Coloplast. This leg mirror has LED lights and a magnifier and rotates 360 degrees to fit your position during catheterization. There are limited quantities available, so make sure you order your free LED leg mirror today.
I don't know if this is still free. This might be an old video, but you can try to still get one from Coloplast and you might be able to have a free one for where you work. But it allows them to be hands-free. One less thing that they have to hold. They can see where they're going. It has the lights because you might be in a dark bathroom somewhere and you need extra light so you can see exactly where you're supposed to insert. And this is going to make all the difference for you. Over here is what I was talking about, a labia spreader. So this holds both of your legs open and wide for you out of the way because they don't have control over their legs. So they can't hold them open themselves. These will hold the legs in place, and then this mirror will allow them to see where they need to insert. So for females, there are just so many considerations, and these are some tips and tricks that are helpful. Also consider the clothing. We have to fully undress as a female versus men. They can just pop out what they need to do, cath, and then go about their business, right? So consider getting them to use some kind of underwear that maybe is a rip on the side or some kind of like Velcro attachment so that they can get to where they need to be faster without maybe having to undress completely all the way, because it really is a hassle and it takes up a lot of energy when you have to get undressed the entire way too. So consider some adaptive clothing or underwear that are out there on the market. And if you're in a warm climate, skirts are very helpful. But if you will live somewhere cold, that's a different story. Now, hand function for uh, intermittent cathing is its own beast. Someone with tetraplegia has dexterity limitations, so a lot of the things that you need are limited by your dexterity limitations. So if you look at the Paralyzed Veterans of America clinical practice guideline, even if you're C7, C8, where you have a little bit more hand function than someone with C5, C6, they even say that those people might need some assistance with toileting for the long term. However, we have had success with people as high as C6, depending on what catheter you use, and they can be independent with cathing. So it makes a big difference the type of catheter that you are trialing with and using with this population, because they have to be able to open the bag, throw away the container, manage the tubing, manage their clothing, manage their body. There's just so many things. Their trunk control is so much more impaired, and they have a little bit more of an uphill battle. So this is my friend Mason, who I love his YouTube channel. He has a lot of really great information on there. And he has a good video about this specific catheter type that worked for him. He's technically a C5 with a little bit of C6 preserved, so he's pretty high level cervical injury. Oops.
After sustaining a spinal cord injury
Sorry.
and becoming a...
See, there we go. Oh no, not an ad.
Yeah, you can tell a doc that.
After sustaining a spinal cord injury and becoming a quadriplegic with no finger function, I didn't think I would be able to catheterize myself independently. But that all changed when I discovered the right catheter. In this video, I'll share how finding the right catheter transformed my life and how you can find the perfect option for your needs too. If you're interested in trying out different catheters, 180 Medical offers free samples and personalized support to help you choose. Check out the article I wrote for 180 Medical about the importance of finding the right catheter, which is linked in the description of this video. Let me know in the comments what catheter you use. If you're new to the channel, my name is Mason Ellis, and I'm a C5 through C7 quadriplegic, and I make videos to help you live life just like you would have able-bodied. Clean the area, but we're extremely messy. The catheter tube was not lubricated.
So essentially this catheter that he's holding up is the one that they normally use in an inpatient rehab setting. It's really long, it's rigid. That's what the nurses were using on him. And he said that's what they sent him home with. He cannot manage that catheter with his hand function and dexterity limitations. And so he was unable to do it himself, and then ended up having his mom have to do it, which, look at the dynamic. His mom's having to cath him. He doesn't want to. He's super young. Like, there's a lot of things that go into consideration. So I'm going to skip to the part where he finds the catheter that he can use, which is called an Eagle board. If you haven't heard or used it before, it's by MTG, called the Eagle board. And he's a C5, and he shows you all the parts, which shows you all of the reasons why he's able to manage it on his own with his dexterity impairments.
So you can choose what works best for you. 180 Medical also provides free samples for you to try that make the decision process easier. While looking at 180 Medical's website, I discovered the Easy Gripper Closed System Catheter Kit by MTG. I wanted to try the catheter to see if I could use it myself, so I contacted 180 Medical, talked to one of their catheter specialists, and they sent me several samples of the Easy Gripper to try. The first time I tried catheterizing myself independently with the Easy Gripper catheter, it took almost 1 hour. Even though it took such a long time, I discovered that catheterizing myself independently was possible. This unlocked so much independence for me and changed my life. The Easy Gripper is a closed system catheter, which is a sterile, pre-lubricated catheter that's contained within a sterile collection bag attached to the catheter. Closed system catheters are sometimes called touchless or no-touch catheters because the user's fingers don't need to directly touch the catheter tube during insertion. This helps reduce the risk of bacterial contamination and is convenient for travel. The Easy Gripper is a catheter kit that includes vinyl gloves, underpad, a BZK wipe, gauze, and a privacy disposal bag. It has a patented gripping handle and the patented MTG Easy Advancer valve for easy catheter advancement during insertion for people with limited hand dexterity, which secures the catheter tube after each forward insertion, making it easier to self-catheterize. Finger access holes on the catheter help with handling. It also features a pre-lubricated introducer tip that helps bypass bacteria in the distal urethra, which may help reduce the risk of urinary tract infections. If you're looking for the right catheter, I highly recommend reaching out to 180 Medical. Their catheter special.
So he has the thumb holes, which help him hold it. That little gripper on the front, he can use his forearm to advance the actual tubing for instead of having to use his pinch because he doesn't have any dexterity to pinch. So he can use his forearm to advance and to pull it back. It's a closed system, so once he takes it out, he just dumps it and he can use that finger hole again to do that. And there's no like opening packages and having to lubricate and all these other things that make it really hard for people. And so let's see, there's some MTG is the manufacturer. Yes. Yes. And so he has a really great YouTube page that has a ton of videos on there. And I love his page because his dexterity is so limited, but he can do so much. And he says that this company can give you samples. What we do in our inpatient rehab hospital, we have samples on hand so that we can try different types of catheters with people and figure out what is the one that's going to work best for them with all the limitations that they have. And so keeping a couple of samples on hand is always helpful if you are working through what is going to be the best for one person versus the other. His name is Mason Ellis. I'll put it in the chat. He is great. Okay, next, I think we've all know and have maybe seen this silver pant hook here to hold the pants down out of the way so that someone can get to where they need to go easier for insertion of the catheter. There's also this U-cuff tubing holder for someone who has quadriplegia because they can't pinch the tubing for the insertion of the catheter. They have this U-cuff adapter, and then this pinch part, they'll press down this lever, and then they can get the tubing in right here, and then they can use the U-cuff to do the insertion. So there's this U-cuff version. This pant hook, a lot of people like it because it's a little more discreet than this big, metal pant holder. So this is a quick little video of a pant hook.
So your hands are in chair bottom. Pant hook.
And what you do is you insert it, and they can leave it under their cushion of their wheelchair. So all they have to do is pull it up, pull their pants down, and I'll show you exactly how it looks. So
between your seat cushion and chair bottom, and pull the hook up to your waistband to get your pants out of the way while you cath. So your hands are completely free.
The difference between this one and this one is that you can't leave this silver one underneath your chair. So it's like another extra step for you. The pant hook, you can leave it underneath. It's discreet. It's black. It blends in probably with your wheelchair. And aesthetics is a big deal. So if they can just leave it there, all they have to do is bring their hand down and pull it up. Even if they don't have the hand function that this person has, I've had some people with quadriplegia just hook their wrist into the little bungee and pull up with their wrist. And then they're able to hook it onto their pants and ready to go after that.
You're finished.
So some considerations for part task versus whole task practice. Figuring out how to cath yourself or doing a bowel program is very overwhelming for people. Like a lot of times they just don't even want to do it in general. So consider how you can break the task down into smaller parts and then maybe get to the whole thing later on down the road. And that might help with their buy-in. help them get used to the idea. So these are just some ideas for you to just break the task down into smaller, more manageable, more digestible parts for them, because I find that people are just overwhelmed by the process, and part tasks can be helpful for that reason.